Hey, I'm Zeb.
And I'm Maddie.
And welcome to the We Don't Know Yet podcast. Whilst both Maddie and I are healthcare practitioners, we understand that there's no one-size-fits-all approach to healthcare. Should you require any medical attention, please seek out your local healthcare practitioner.
Guys, we are no longer in Zeb's backyard.
No.
Not that there was anything wrong with it, but
I kind of missed it a little bit.
It
was
nice.
For context, guys, I used to get home from basketball on a Monday morning and I used to make myself eggs and some brekkie and wait for Maddie to rock up.
It was very humble half an hour later.
Yeah. I was about to say, it was nice for me because I just got to roll out of bed straight into set, whereas Maddie was like, I'll be there in half an hour. I'm on my way, I promise.
Oh, it was so bad. No, it was a nice backyard and it definitely served its time, but now we're moving up in the world.
Yeah, we're moving up in the world.
Yes.
We've definitely discussed the fact that we wanted some controlled variables. We didn't want to have birds chirping in the background too much.
Yep, your neighbour doing their renos or like, what was it, the garbage, or not garbage man.
No, the ambulance, we had the ambulance go past a couple of times.
Ambulance once, yeah.
So
rain.
Yeah. Well, rain was the big one because I think the scare of getting washed out was huge.
Yes, and mind you, we are not yet, but soon heading into like the cooler months. Yeah, like doing a podcast outside.
Yeah, I was about to say, now that you say that, I think about when we started and when we actually started recording.
Yeah,
we probably got really lucky because we had a lot of. You know, I'm from Melbourne, so I'm used to rain every 5 seconds, whereas at the minute it's kind of been like.
It's been pretty good.
Yeah, pretty nice.
Touch wood.
We'd like to take a break from today's episode to give a quick shout out to our sponsors, Drip Digital. They manage all of our audio and video editing as well as our social media marketing. Without them, the We Don't Know Yet podcast wouldn't be possible. So thank you again.
But yes, we are live from a much more controlled environment. We are now going to be doing all of our eps outside of the Grey Creative out in Karen Point.
Karen Point.
Yeah, I was like, is it Karen or Tarrant Point? The context, they're much the same. But yes, it's Tarrant Point if we're being technical.
Yeah.
We'll pop the link in the show notes to their Instagram page, but it is the Grey_Creative.
Yes.
Yeah, heaps excited to be moving on up in the world.
Yeah, really exciting move from us, I think.
I know.
We sat down with Trent not long ago.
Yes.
Trent for those who don't know, I think we're going to get him in here at some stage. I'm adamant on getting him in on some of the feeds. So we'll get him in and introduce you guys to him. But he's been really cool. He's kind of been super happy to sit down and talk out a little bit of a sponsorship deal. We're so happy to be in his space.
Makes it simpler, like makes it a lot easier in our behalf. So we kind of just rock up, do our thing. Like it's all set up. It all looks really pretty. For context, it is a podcast studio, a cyclorama, a photography studio.
Yeah, multi-work station
What's
place.
What's the word?
Co-working space. That's the one. I knew there was a multi something. And then there's like a group co-work setting as well. I think that he's going to open up here, but
it's pretty cool.
Yeah, it's pretty cool. It's all still really in the works.
Yes.
He's done a great job at getting the potty studio up and running.
Yeah,
like from the get go.
Yes.
And I know we're going to do a little bit of a walkthrough on some socials soon, but he's going to have, or it might have already actually gone out by the time this episode airs. Yeah. But
check our socials, guys.
Yeah. He's got the cyclorama up already, which is cool out there outside there, and
it's really good.
Lots of curves, lots of aesthetics.
Very, very aesthetic. And it's like, what's a walkway, like the curvy walkway?
Yeah.
Guys, you'll just have to check our socials to see.
Yeah. Or check out their socials as well, because I'm sure in a couple of weeks' time when this goes up,
it'll be done.
It'll be, pretty well progressed.
Yes.
So we'll see where we're at then.
Absolutely. But very, very grateful. It just makes things a whole lot easier and just helps us pump out more episodes for you guys as well, which is cool.
Yeah.
Speaking of, today we're going to be talking, I guess, a little bit one-on-one, which we haven't done in a while, really.
Yeah. Or we did last episode.
But like, aside from that one,
consistently we haven't done too much one-on-one. I know originally when we first started, we did a lot of one-on-one.
Yeah, it's just been fun meeting people and talking to them.
It has, and I think we can really dive out of our field a little bit and dive into some other fields, which is good when we get other people in.
Yes.
But we're kind of taking it back a little bit today. But before we go there, how was your kind of last weekend just gone?
Good. It was actually it was pretty chill. I'm just trying to think what I did. Oh, actually, no, it was not chill. But it was good. Like, it wasn't, like, hectic. It was just, like, a lot of social. Like
Maddie saying her weekends are chill.
Yeah, it was so chill. Actually, excuse me. The one prior to that was so chill.
It was. You actually did have very nice weekend.
I had, what was the word? Epsom salt bars and read books, and it was lovely. Yeah. I didn't do that this weekend though. One of my best mates, it's her birthday. We normally go down. Kate, shout out to Kate. We normally go down the coast every single year for her birthday since as long as I can remember.
Yeah.
But this year she was like, look, let's just do what we do down there, but back up here in Sydney. So we had a bit of like a Kate-a-thon across the weekend, which was really fun.
It looks really good.
It was very wholesome. How was yours?
Yeah, mine was hectic. Mine was hectic.
Doofing.
Yeah, I have work on the weekend, which is my typical Friday, Saturday setup anyway.
Yeah.
But yeah, and then we ventured off to Laneway on Sunday with Beck, which was really cool.
Yeah.
Friend of the show, Beck.
Yeah, shout out to Beck.
And Laneway was sick. I dabbled in the afternoon in non-alcoholic beverages because I had a 6 a.m. training on Monday morning.
Oh, rip.
Yeah, well, kind of rip, but kind of also like really nice.
Yeah.
Low key, I'm going hard for the non-alco bevs at the minute. I'm trying to do the right, I'm trying to practice what I preach a little bit.
Oh, for sure. Oh, no, not rip to the non-alcoholic. I'm a massive fan of drinking
Oh,
non-alcoholic.
you rip to the 6 a.m.
Yeah, I was like, that's a lot.
Well, yeah, the 6 a.m. was a bit intense. We didn't get home until, I think, like 11:45 on Sunday night. And we were kind of like, it's so late. But it was really worth it.
Yeah, it was good.
Yeah, it was
Favorite
so good.
act?
Oh, see, this was hotly discussed on Sunday in the car on the way home.
Yeah.
I absolutely love Skin on Skin.
Yep.
Gabby, my partner, would argue that with me, and she would say Horse Girl was the best.
It's just that one song. Like, I know she definitely has more than one song, but it's just like, long man.
Maddie's favourite song.
Yeah.
Cue Maddie's favourite song.
Actually, nice crossover. So Zeb saw Horse Girl, and I met Ollie Bowman on Friday. The guy that's like notorious on socials for doing that little shoulder dance. Yeah. I was embarrassing.
I know, it was a bit of a Horse Girl weekend.
Yeah, it was a Horse Girl-a-thon.
Yeah. Not a Kate-a-thon, a horse. Oh gosh, we're gonna capture that as like that's gonna be a sound moving forward. Maddie's name.
That's a horrible name. It's like every time I try and do an accent and it just always ends up sounding like an Indian accent. I'm like, I need to diversify this a bit.
Well, yeah, no, so it was really good.
Yeah,
it was really good.
But really good.
Horse Girl was good, but
yeah,
Gabby was so excited that she wants to go again this Friday.
Yeah, a few of my mates are going.
She's playing in Sydney again this week, so
yeah.
Who knows? I might end up at Horse Girl again on Friday night. We'll just wait and see.
Tickets are not too expensive either.
Yeah, I think $70 was like
not too bad,
which is cool.
Back to the non-alcoholic drinkies though. I'm a massive fan of those.
Yeah, I honestly think there's a real market there for them.
100%.
So since the start of the year, I don't know. I just have had because I've been so back into basketball. I think just trying to like do the right thing.
Yeah, but you can still go and socialize. You still have fun.
Yeah,
you're
my
still
big thing is
something.
I can't remember who we were talking. I swear we were talking to someone about this. Maybe we weren't. Oh no, actually, maybe I was listening to Atomic Habits. The book. They were talking about like smoking and how smoking's obviously a very addicting kind of practice.
Yeah.
But it tends to be really behavior associated. So, like, for example, I think in the book he talks about how his uncle used to get in the car and every time he got in the car, he used to have a cigarette.
Right.
So that used to be like his,
like it's
pull up the glove box, pull the cigarettes out, have a cigarette.
Yeah.
So that was the thing that was keeping the kind of behavior or the addiction around. And he changes the cigarettes for lollipops. So every time he gets in the car, instead of grabbing a cigarette out of the glove box, he grabs a lollipop out and puts it in his mouth.
Okay.
Anyway, like for me, I enjoy socializing with people. I love socializing with people. If you know me really well, you know that I like getting around.
Man is social.
Everyone.
Yeah.
But yeah, I think I don't know. Just the start of this year, I was like, let's just try and dial it in a little bit.
Yeah.
And yeah, the non-alco beers. There's so many different types.
Yeah.
You can still get out and hold something. My biggest thing is I don't know what to do with my hands sometimes.
Yeah, 100%.
So like go and buy a non-alcoholic beer.
I think it's just the act of sipping. Like I'll often just have a soda water because I'm like, if everyone's sipping, I kind of want to sip, but I don't necessarily want to drink alcohol.
Yeah. Well, you know what the most mind-boggling thing was? Since I started looking into the non-alcoholic beers, I didn't realize that they could be like 0.5% alcohol, or they can have like 0.1 standard drinks in them. I thought it had to be like 0.0.
Nah.
But no, it's not.
Because if you had 10, I'm sure it wouldn't obviously be as much as if you had 10 meetings, but
10 in an hour.
Yeah, yeah, gosh.
Oh,
yeah, that's just like a bellyache. Oh,
yeah, but you know, like I couldn't believe I went in and was looking at some of the non-alcoholic beers that they had, and yeah, it was like ones that would say 0.1 standard drinks, and I was like,
yeah.
But then there's others that are like 0.0.
Yeah,
so
there's a
fun fact, just in case you didn't know that.
It's so good though. Like I'm a massive fan of it. There's a certain brand that's available at Woolworths. Might be at Coles too, but I only shop at Woolies. Bit of a snob that way. But it's Aperol spritzers, and I kid you not, it tastes exactly like an Aperol.
Yeah,
and like I love me an Aperol, but obviously you can't drink them repeatedly, otherwise you get it like a little bit drunk. So it's really good. It tastes exactly the same, and it's non-alcoholic.
Oh wow.
Yeah,
how good's
big
that?
fan. Shout out to non-alcoholic drinks everywhere. We love you.
Yeah, we love you. Big, all about it.
All about it. Alrighty, let's dive in.
So let's dive in.
Yeah. Bit of a one-on-one chat, guys. So in the last ep, Zeb interviewed me about what I do in the ED space and at Sweet Spot Health. Now it's time to flip the script. So do you want to introduce what we're going to be diving into?
So I tossed and turned about this topic a little bit because I think there's so much information out there already, and I don't really know how deep we can go into it, but we're going to be talking a little bit about osteopathy, and the main reason that I was pretty keen to talk a little bit about it is because at the minute we're in Sydney.
Yeah.
But in Melbourne, I feel like it's a very common practice.
Yeah.
Up here, it just seems so sparse.
Honestly, prior to meeting you and Gabby, no idea what an osteopath did.
Yeah, we've kind of said it before, and this in a sense that I think here in the Shire. Yeah. I think there's maybe like 1 or 2 or 3 osteopaths that I'm aware of, or practices that I'm aware of that have multiple osteopaths within the practice. Other than that, it's just like there might be like pockets of like one osteo working out of like a medical practice somewhere.
Right. Yeah.
But yeah, I'm surprised at how small it is in New South Wales, and I feel like if I'm shocked by how small it is in New South Wales, I'd be even more shocked by how small it is in other states like Queensland or WA or Adelaide or Northern Territory.
I wonder globally like what it's like.
Yeah, I think, and we'll dive into this a little bit later on, but I think it changes depending on where you go in the world.
Yeah.
But yeah, anyway, in Australia,
bit
not
here,
really,
there and everywhere.
Yeah, it's a bit all over the shop. So today we're going to just unpack what it is, because I think I get a lot of like, are you a bone doctor?
Are you a woo? Like I feel like it gives witch doctor vibes, but you're definitely not.
Yeah. Yeah. And yeah, I think that's just because people don't really know what it is.
100%. People don't know, don't really take the time to look it up, and then just make up some shit.
Yeah. Literally.
But after seeing an osteopath since meeting you, I am the biggest fangirl. I think they're brilliant.
Yeah. Well, yeah, we hope that people enjoy our practice, I suppose. I mean, we're not, the big thing being that we're not that different from any other allied health practitioner. So, you kind of know what you're in for a little bit.
Yeah.
But yeah, let's kind of break into it a little bit, I reckon.
Yeah. First and foremost, I just want to say I'm really, really glad at the start of today that you clarified it's osteopathy, not osteopathy, because that's definitely what I was calling it.
Tomato.
Much of a muchness. Before we dive into, I guess, the technicalities of osteopathy, I got it. There we go.
You can short it to osteo if you want.
Osteo. I'm just going to run with osteo, guys.
Let's just run with that.
Yeah. Could you tell everybody, and me as well, I don't actually think we've really had a proper in-depth conversation about your journey into becoming an osteo and all that jazz.
Yeah, well, so I always wanted to be a physio when I was growing up. That was like the big thing. And I think whenever you're involved in a sporty kind of background, you want to end up in the healthcare industry.
Yeah.
Just because a lot of the time when you go through like junior sports, you end up seeing half the allied health, industry anyway.
Yeah.
But everyone's got their own practitioners that they go to. I originally went to Physio Sports in Brighton. Shout out Physio Sports. And found a love for the allied health space. And then as I was going through high school, my mum actually ended up working for a chiropractor / osteopath. So he had dual quals between the two.
Well, one man, both qualifications.
Yeah, one man, both qualifications.
That's a lot of years of study.
It is. So, but a really cool spin on things, because obviously there are slight differences between all the allied health practitioners. But yeah, to have a bit of a combination and work off both models a little bit was really cool. So she was working for him and just in admin, and I used to go in and see him for injuries and things like that when I was playing basketball growing up, and loved it, absolutely loved it. So for me, it kind of became this new natural progression of like, once I finish high school, I'll have a look at physio, osteo, chiro, see which one I kind of want to mesh into. And then go from there. And then I think first year out of uni, I didn't end up in either of those courses. I was just doing like a really broad general health science degree. And then I kind of saw the osteo promo pop up at RMIT and was like, I think I'm going to give it a crack. Pun intended.
Baracha.
And loved it. 5 years at university down there in RMIT. Yeah, long time, which is cool. But love the experience of the university environment and getting involved in all things osteo.
Yeah, you were a big uni guy, weren't you?
Yeah, huge uni guy. I loved it. I thought it was the best environment. And the big thing about a lot of the allied health kind of degrees is that to come into an industry, we have to talk to people on a day-to-day basis. You have to be pretty well equipped with some social skills. So then when you look at networking and communications at the university level, when you're not actually in industry yet, where everyone's trying to meet new people, make new friends, get involved in some things that they've never tried before, it becomes this big pool of just opportunities to immerse yourself in. And I thought it was like the best thing ever. So I got involved in everything. I ran the osteo club for a few years down at RMIT.
So cute.
I sat with the RMIT sport group, which was like the big sporting group of RMIT, and was really lucky to be involved with a lot of the sport collab stuff and sit down with some of the university leaders and kind of get to know them a little bit more personally, which was really cool. But yeah, and then whilst I was at uni as well, I had the privilege of actually doing some volunteer work in industry as well. So not as osteopath. I did some observations in kind of my junior years as like a student osteopath, which is like you go into the clinics and you see what osteos do. But then I also picked up some quals in sport training and got involved in the sporting scene. So I was really lucky to go and have a stint with or run a couple of games with Greater Western Sydney's AFLW team and learn some things under their allied health team there. And then also physio sports, back to physio sports, which is one of my favourite physio clinics in the entire world. I was working there across the university just in reception. But I became affiliated with a lot of their sponsor clubs that they were kind of doing a lot of work with. So I was doing a lot of work for them under kind of their banner.
Oh my gosh.
And working with a couple of different sporting teams like Caulfield Grammar and the old boys at Caulfield too. So yeah, it was really cool. And the best thing about that was that I was exposed to so many different areas. To see, you don't need to be an osteo only or a physio only or a chiro only. A lot of practitioners have their own way of practicing. And they're all so open-minded about, or the ones that I kind of were introduced to and met, they're all really open-minded about practice. So, they're happy to bring you on board. If you want to be a sponge and you just want to learn, they're happy to have you there.
Yeah, I feel like you're the perfect example of like how mindset is everything. Like, I think our uni experiences first and foremost was so different because I definitely didn't have the right mindset. So I think you were just like coming into that, you were so eager to be there and just wanted to like, as you said, like absorb every opportunity, and it paid off. It's pretty cool.
Yeah, well, it's hard. Today's day and age, we've gone so digital now that connections like really been severed a little bit, I think. So, when I started at uni, every class was face to face. Every lecture they recorded, but you benefit the most if you're actually there in the lecture theatres. And I think it's really cool when you can create a bit of an environment where you have friends that actually make you want to go. I think social drive is like the biggest thing for anyone who's wanting to learn. Like if you want to get active, if you want to learn something new, like to have moral support and social support, it's like the most motivating thing ever. So
100%.
I just got really lucky that I fell into such a great space where people were kind of, really about just sticking together and going through things together. So
yeah, no, it's really cool.
Good, yeah.
So that was down in Melbs.
That was down in Melbs.
A little about the transition to SID.
Yeah, well, we kind of got towards the end of the degree, and we went through COVID for the last few years. So, really intense thing to be learning during COVID, because
particularly Melbourne.
Yeah, well, it was all hands on. Like our practice is all hands on. So you got to be patient facing, face to face. They tried to peel off and do a lot of telehealth stuff, but at the end of the day, that's just something that, I think is a bit niche.
It's a little bit tough with such a, as you said, hands-on profession.
Yeah, agreed. So really tricky to kind of coach and teach during a pandemic when everyone's meant to be isolating at home. We still had a lot of opportunities and did a lot of placement stuff, which was really good, but probably really short. We fell really short in terms of where we probably wanted to be at finishing uni. But like I said before, I was really lucky because I had a lot of the prior experience of working in hands-on scenarios, which is good. But we heard about a few of our friends, one being my new housemate, Harry, who's just moved in with us in December, who had moved up to Sydney, and they were loving life up here as an osteopath. I think the big thing and the big driver being that there was so little osteopaths up here. And the osteopaths up here practice very traditionally, but like very open-minded. It just looked like a really cool environment to learn more in. And they say for the first 5 years of your, clinical practice, you're just going to be learning, absorbing, trying to make sense of what you've learned at uni and how that actually relates to the real world. So Gab, my partner, and I were just kind of like, let's just muck around with it. Let's get up there and just see something different. And, hopefully we'll really benefit from being in an environment that, pushes us a bit, which absolutely has. Like, we've had to learn on the fly a lot and kind of navigate different situations and scenarios from a workplace setting and and living situation as well, being away from friends and family. But then we ended up here, and it's been great.
Love that. Amazing.
Yeah. So we're working. I work down the road from here in Sutherland, and then I also work out west at In Touch Health Co.
Out at
Gregory Hills. Yep. And Gabby works at Sutherland with me, and she's there full time. So.
I love that you guys work together. It's really cute.
Yeah. Well, it never really meant to set up like that. I was meant to be down in Wollongong. She was meant to be here, and then our friends were all up in Marrickville. So that's kind of how we ended up banging the Shire. But things just fall into place how they fall into place. And here we are.
And it's not like you guys are side by side next to each other on a desk all day. Like, you barely see each other.
Yeah, well, that's the thing. We're patient facing all day. So, we're kind of in the rooms, and it's really nice because we go into work together, see patients, don't really see each other, and then finish the day and we just roll home together, which is nice.
Love that.
Yeah, it's good. But that's kind of how we ended up here. And then we met you guys, and we love it.
We made you guys have made such a nice little friend group as well.
Oh yeah, it's been so good to come up here and introduce ourselves to people. I always tell people the first time I really tried to branch out of my comfort zone, and which sounds weird to say because I've always just naturally put myself in the spotlight and force myself.
Extroverted.
But I remember rocking up at URC and just being like, oh my God, I'm in a new state. I don't know anyone. I'm just standing here with my coffee at the back of the pack trying to talk to people. What is happening?
Yeah. I actually can't even, to be completely honest, I can't even remember the first time we met each other, vaguely, but not the first, hey, what's your name? That sort of moment.
Yeah.
I don't know.
I don't even think there was a hey, what's your name moment. I was talking to Erin about this the other day, who's also a friend of the show.
Yes.
She, we literally, I think, just we were running, and then we both took a wrong turn and got lost. And then she was like, "Do you know where you're going?" And I was like, "No."
That was it.
Do you know where you're going? And she's
the rest is history.
Nah. And then with me and you, I think I was standing in line at Grind in Cronulla.
Shout out to Grind. We're giving a lot of shout outs.
Yeah, we're getting a big lot of shout outs.
Sponsor us.
But and then I remember, and sponsor us. But then I remember being like, oh, you're running Huskerson? And you're like, no, I'm not running Huskerson. Oh, no. Are you running the
Sydney one?
The Sydney Marathon? And you're like, no, I'm running Huskerson in a few months. And I was like, oh, nice.
Yeah.
So that was how I remember.
Love that. Yeah. And the rest is history. Here we are.
The rest is history.
Alrighty.
Anyway, yeah. So
I guess
that's kind of brought us into
I hate
private
those
practice. I know private practice now, where we're going to unpack now a little bit about
what the heck
osteopathy
actually is.
Yeah.
Oh my! There will come a time where it's not so forced.
Yeah, I know, osteopathy.
Yes. So can we strip it back, and can you, I guess, give me, just personally for me, really just for selfish reasons, like a dummy's edition of like what osteopathy is?
Yeah. Well, I think the easiest way to explain it is we're not just about bones, like everyone keeps asking me.
You're not a bone doctor.
Yeah. We're a bit about everything. So we look at the body as this big, multifaceted being and structure that relies on its own self-preservation to kind of keep moving forward. Mm-hmm. We have a real kind of whole body approach when it comes to managing issues, whether they be injuries or sometimes systemic things as well. We kind of consider a lot of different areas of someone's life when we're looking at their presentation or what they're actually coming in to see us for. Mm-hmm. Which I think sets us a little bit aside from some of the other health professionals. The way that we approach different scenarios can be a little bit different sometimes, but there's always a little bit of a mentality to treat the root problem of the cause of the pain or whatever someone's coming in to see us for, not just treating like the overbearing symptoms. And that's kind of like the big takeaway. It's like trying to actually unpack things to find the root problem.
It's not just a Band-Aid approach.
Yeah, we're not just trying to kind of like settle someone's symptoms and send them on their way. It's like why are they, asking those questions about like why are they getting this?
Yep.
Are there other influences kind of having an impact on that person?
Yep.
And then how does that influence or impact their overall health?
Yeah, I really like the holistic nature as well. Like even from a personal experience, when I went and saw your partner Gab for a treatment, I think I had a sore knee at the time. And she ended up like explaining that it's all connected to my hip and my pelvis. And I was like, it's really cool to get that understanding of it rather than the stock stand of like, ice your knee, rest your knee.
Yeah.
Like she actually went into the effort to explain like why this is happening and what I need to do.
Yeah. And the hardest thing is that the thing that I'm still toying with now and trying to get across to people is that, and this is probably a big driver for why we talk about some of this stuff on the podcast is, I found people really, like people don't have the same education that we do in terms of the healthcare system, the body, the body's functions, the structures. So for someone to come in and listen to a healthcare practitioner try and really unpack everything for them in one session can be really
it's a lot
challenging. Yeah, because people get overwhelmed really easily. So it is really interesting, but at the same time, sometimes people just want the
just make it better.
Yeah, just please help me kind of scenario. Which I've tried to steer clear of a little bit. I've lent into a little bit more in more recent times just because of the fact that I think you need to really build a bit of rapport and trust with someone before, you start to unpack further things that could be going on in the background.
Yes.
It is really cool how it's very multi-dimensional. We're not just looking at one region of the body and going, let's just focus on this one thing.
Yep.
We're kind of trying to factor in so many different things at once and paint a bit of a picture to it for ourselves.
Yeah, amazing. Sense. And I guess where does that land, or where does osteopathy as a whole land in today's healthcare setting? I think people are shifting more towards a holistic approach. Yeah,
well, this is the thing, isn't it? So the health and wellness space is huge now.
Yeah.
So I because I come from a sporting background, I like relating everything back to sport. But if you look at professional sport in today's day and age, osteopathy used to be something that never used to make mention in professional sport. But now there's AFL teams in Victoria and around Australia that are integrating osteopaths into their medical team. Mm-hmm. And they work in collaboration with doctors, with physios, with EPs, with strength and conditioning coaches. There's osteos that have qualifications in strength and conditioning. They have like specialty qualifications now.
Yeah.
So osteo is one of those industries that's slowly but surely growing.
Yep.
And yeah, it's making a bit more of a headway in terms of, we actually can be involved in that multidisciplinary approach to managing a patient.
Yeah, it's not such a novel thing anymore.
Yeah,
it's becoming more commonplace.
Yeah, and I'm a big believer that there's not kind of one best style of practice. I think everyone has their preferred style of practice.
Yeah.
But there's not a king of the kids in any scenario. Like osteo is not here to kind of be like we're the goat, we're the best.
Yeah.
We're just here to kind of say we can really make a strong contribution to someone.
Yep.
And strong contribution to a multidisciplinary team as well, like people managing an individual. We can fit into that really well.
Yeah, awesome. And you mentioned before when you were at uni, obviously the last couple of years were via telehealth because of COVID.
Yeah.
And that would have been really tricky because your degree is primarily quite hands-on.
Yeah.
Can you explain a little bit about, I guess, now that you are working day-to-day in the osteo space, the hands-on nature of it? Like, what do you do with your hands?
Yeah. What do you do with your hands?
Sounds a little bit
Whoa, Maddie, whoa. Big question.
Well, how are your hands, I guess, a central tool that you use?
Yeah.
Yeah.
Well, so like anything, and this is a big part of the allied health space in general, we have a number of different techniques and things that we use to help manage people's pain and help treat them and help them, guide them in the right direction. Just like a physio would do massage, we have other like techniques and things that we would use in a scenario to try and elicit someone's or try and elicit some change for someone. Mm-hmm. So like we like the physios use a little bit of soft tissue massage, but we use a combination of that with some of their other techniques like joint mobilizations or articulations.
Yep.
And then we pair that with some other techniques that come from like your chiropractic background. So we do some manual kind of adjustment techniques, and which is the typical cracking that everyone looks at on social media.
Yeah.
But yeah, like in between those two spectrums, there's a number of other things that we use. Taping, cupping, needling.
It's a bit of everything.
Yeah, we use a lot of different styles to try and help someone kind of get through a pain episode or help further themselves as well.
Yeah, amazing. And with that being said, I can understand it would be so individualized, but what is the overall goal? Like to alleviate pain, to improve mobility? Like what does that look like?
Yeah, well, and like you said, I think it's a really individual approach to each different scenario. So no two persons going to have the same treatment. The style of treatment's going to differ. Some people hate needles, so we won't touch the needles. Some people don't want those red spots on their back, so we won't touch the cups. Some people don't like the cracking, so we won't use the cracking. But I think the coolest part about like our space is that we've got a big tool belt, lots of different tools on the belt. We don't necessarily have to use one primary kind of tool.
Yeah.
We can justify using a lot of other different techniques to actually try and solve someone's problems. So
yeah, amazing. I love the needles. Like needles freak me the heck out.
Oh, they freak me out.
Yeah, but like if you don't look, so I always normally get them on my calf, and like it just feels cool. It's really fun when they hit a nerve and your whole leg like spasms. I accidentally once kicked my physio because he put it so far into my Achilles, my whole foot just went like it was so involuntary, and I was like, I'm so sorry. And he's like, it happens all the time.
It happens all the time.
Yeah.
It's normal. It's meant to happen.
Yeah, and because like I work out of the physio space, like for context, I ran a room out of like a physio office. Like I'll just be giggling the whole time. And he's like, man, the noises that must be coming from this room, because I'm like, it hurts so much. But they are really good.
Yeah, well, they're nice. But I have almost a little bit of a phobia of needles.
Do you?
Yeah, but it's funny because like I can put them in people, no problem.
Yeah.
I remember doing the needling course that you do once you graduate, because it's a separate part of our industry. You don't actually graduate with the quals to do some of the needling. You go and do some further practice.
Yep.
But I remember going to the 2-day course, and you're pretty much a pin cushion.
That would freak me out.
And like you're trying to work on like your landmarks, anatomy, find the spot for the needle, put the needle in. And I just remember being freaked the hell out because Gabrielle will attest to the fact that she's one of the only people that can actually put a needle in me now because I trust her.
She's really good.
Yeah. She's good at it.
She's great.
Yeah.
Oh, that's freaky. Slight tangent, but it is related. I got a blood test a few weeks ago and the lady was like so lovely and chatting to me about how she got into like pathology. But she said the same, like when they were practicing at pathology school, I don't know what it's called, they all had to do blood tests on one another and like draw like quite a lot of vials of blood. I was like, that is bleh.
Yeah, well, you think about it, right? And it sets up that empathy with a patient. But like, I would hate to have someone doing something to me that they haven't had done to them.
Oh, would you get a tattoo from a guy that doesn't have a tattoo?
Yeah.
No.
Absolutely not.
Yeah.
You know, so
I don't know if that's a good analogy.
Yeah. I don't know if that's a good analogy either. But, you know, I wouldn't want someone sticking needles in me if they haven't had needles in them, so they can't relate to it. So
yeah.
But yeah, like it's just one of those things where you kind of have to experience it first, and then you can kind of have the confidence to go ahead.
Yeah, but it's also not all just needles, as you said. It's just one tool.
Yeah, one tool. And
if you don't like needles, you don't have to do them.
Yeah, and people often refer to it as like acupuncture. It's not acupuncture.
Yep.
I want to make a big point. Acupuncture is like amazing. It is such a cool space, and we're gonna hopefully in the next few weeks get someone to talk about acupuncture a little bit more in detail.
Whoop, whoop.
Acupuncture is awesome.
Actually.
It's a more musculoskeletal approach with the needling that we use, whereas acupuncture hits on so many more different levels.
Yep. Okay.
And I'm not going to speak to acupuncture because I wouldn't do it justice.
Yeah. Stay tuned, guys.
Stay tuned.
Episode to come.
Yeah.
Okay. So say I've never been to an osteo before in my life. What would be some conditions that I might be experiencing for me to go to you?
Yeah.
Does that make sense?
Yeah. So the typical stuff that we tend to see is back pain, neck pain, pelvic pain. I would say majority of our caseload would make that up.
Yep.
But at the same time, like we're living in a world now where osteo is becoming a lot more recognised as an allied health practitioner. So, you know, I see a lot of shoulders, I see a lot of hips, I see a lot of knees, I see a lot of feet.
Yep.
I think the conditions that we see, you know, across the board, they range from disc bulges to, you know, ACLs to, you know, bursitis of the shoulder, frozen shoulder. So we see so many different conditions nowadays because I think of the fact that people will trust their practitioner to manage their pain.
Yep.
So it doesn't tend to be about, you know, what do we see? It more depends on who we see. Just like a physio will manage someone with a rotator cuff tear.
Yep.
We also would manage someone with a rotator cuff tear.
Right, okay.
We might just have a different approach to it.
Yeah.
So we still see all the same things that your chiropractor and your physio would see.
Yep.
Even your podiatrist, we kind of really tie off really nicely with too.
Yeah, cool.
Yeah, the only difference is being that we might manage it in a slightly different way from them.
Yeah. You know what I discovered yesterday, actually? I was talking to someone at work. They took their newborn baby to an osteo when they were born because of the contortion that happens in the process of being birthed. And it's pretty cool.
Yeah, well, and this goes back to a lot of the more...
It's a bit of a niche.
I'm going to use the word traditional very loosely here, but but in today's day and age, everything's becoming very westernized. So our degree has a very Western origin now. You know, the further and further research develops and science develops, the more the universities want to push that research and science factor when they're talking about science.
Yeah.
So we have a very westernized approach, some of us new school osteos.
Yep.
But there's a bigger traditional kind of older practice of osteo that exists.
Right, okay.
And within that, and these are going to sound like really wacky words, but there's cranial osteo practice, balanced ligamentous tension practice, counter strain practice, and a lot of those more traditional techniques, which we get taught to a capacity at the university level.
Yep.
They can be used as more, we call them like indirect style of techniques. I don't like the word indirect either because indirect sounds like we don't touch the person when we do it.
Yeah.
But
you are feeling pain.
Yeah, I think people commonly affiliate direct treatment with like, I'm going to get a needle and I'm going to stick it into the tissue.
Yeah.
I'm going to get a cup and I'm going to put it on the tissue.
Yep.
I'm going to crack like one of the, or adjust one of the joints. You know, whereas like your indirect, I usually refer, probably indirect's the wrong word, probably more gentle style of treatment.
Okay.
Yeah,
cool.
For those who prefer that side of it, which is cool.
Yeah, right.
So that probably goes back to a lot more of the traditional osteo practice of how every, they look at the, well, it's alike because we look at the whole body too, but it's just a lot less invasive than some of the more direct treatments that we use today.
Gotcha.
If that makes sense.
So it's getting more invasive as time goes on. Ish.
Yeah. More invasive.
More hands-on?
Well, and this is the thing. So without actually being able to show you what the practice looks like and how it differs from one another, I think they're both just as hands-on. The hands are on the person that we're treating.
Yep.
But the only thing being that we're probably using more of your routine, well-researched techniques these days.
Gotcha.
At the university level. Once people come out and they do their own professional development, they tend to find all these fantastic and wonderful techniques that are seemingly getting a little bit lost in the modernization of osteopathy.
Yep.
But yeah, like, your typical things like soft tissue massage, joint mobilization, articulations, high velocity, low amplitude adjustments like the cracking. They're the ones that people typically start to associate us with because of the fact that, in a research space, they're the ones that are easier to kind of quantify.
Yeah, gotcha. Okay.
But yeah, and they've probably got more of the research around them versus some of the older traditional osteo techniques. But yeah, I like the fact that there's kind of a little bit more of like a traditional side of osteo that you can really pick up and run with too.
Oh, for sure.
But yeah, it's very different to like what you would probably think like or expect from a treatment from like a chiro, physio or osteo these days.
Yeah, and look, I guess that segues really nicely into my next question. Like off the back of that, you did mention that when an osteo does quite sit in a similar space as like a chiro, a physio, an S&C coach, probably maybe not so much the latter. But how do you find working as part of a multidisciplinary team? Like, do you often see a patient or a client that has yourself and maybe a physio or a chiro as well? Yeah.
So I think, and this itself is like a really individual experience. We tend to see someone who might go and see like a physiotherapist or a chiropractor. They might have seen a physiotherapist and not had any success.
Right.
They might have seen a chiropractor and not had any success.
Mm-hmm.
They might have even seen an osteo, and it goes vice versa as well. They might have seen an osteo before seeing like a physio and had no success with the osteo.
Yeah.
But we sit kind of alongside those allied health professions like your chiros and your physios.
Yep.
And then we probably integrate and work in more of a multidisciplinary team with, say, like your doctors and your acupuncturists, your Chinese medicine practitioners, your naturopaths, your psychologists. So we kind of fit in with and make part of that multidisciplinary team.
Mm-hmm.
It's really common for a lot of osteo practices now to have, like an acupuncturist or a naturopath or...
Really?
Yeah, psychologist or...
It's pretty cool.
Even physios. There's a lot of practices now that are opening that have osteo, chiro and physio all accessible at one location. And that's just because of the fact that, again, like...
Diversifies it.
And everyone's going to have their own preference. Some people really like the way that their physio treats, and that's great. Like they'll stick with their physio, and I'm all for that.
Yeah, finding what works for them.
Yeah. But if they want to dabble and try something different, or and again, I struggle to see the real difference between the industries apart from our principles these days, because we all have the same goal in mind for people. We're just trying to get them better. So at the end of the day, wherever you go, you're going to get some sort of benefit.
Patient-centered care.
Yeah, absolutely.
So from a multidisciplinary team approach, I guess it would be more with not so much them, but more, as you said, doctors, naturopaths, etc.
Yeah. And look, I mean, there's definitely scenarios where, like, I've worked with physios before. I mean, currently at my practices, I don't have access to a gym. Mm-hmm. So, in that scenario, for me, I like the element of rehab and using strength training to really bolster someone's health.
Yep.
So, it might get to a stage where I've hit a bit of a capacity with a patient that I think really needs to be in a gym space. Financially, if they can't come and see me and the physio, I'm not going to sit there and be like, well, keep coming back to see me, and we can kind of try and work around some things.
Yep.
Yeah, it might be right. Like, you can come back and touch base with me if you want.
Yep.
And get some more hands-on treatment, but let's get you in the gym with like a physio and start to take you through your rehab a little bit more.
Yeah, look, I really appreciate that. And I guess not obviously just going to quickly touch on it. It's very similar to what I would do in work. Like if a client can't afford to see both a psychologist and myself, and they are clearly really going to be benefiting more from the psychological treatment, I kind of go, look, let's just pause our sessions, like come back if and whenever you need.
Yeah.
But I think you're going to get a lot more benefit there for the time being.
Yeah, it is hard and I think we spoke about this with Eden a couple of weeks ago.
Yeah.
And her outlook on, when she's training people, she wants them to experience a form of exercise that she kind of that suits them, that they're really happy with. And if that's not strength training, she's not going to kind of keep bringing them back to.
I think that's just such a good value to come back to, though.
Yeah, it is. So like it's the same with us. So if they're not getting as much benefit, or if I feel like they're not getting as much benefit from me, or if I feel like they'd benefit from seeing another healthcare practitioner, I'm not going to tell them to keep coming back weekly to see me. Yes, I might be at a bit of a financial loss in the short term, but I think the rapport that you build from that with a patient, the fact that they see that you've got their best interest at heart,
100%,
then becomes a scenario where, like, if they've got something that they need verification or clarification, or they want to have a treatment more hands-on style, they'll come back and see me.
Yeah, and they tell their friends and their family and et cetera, et cetera.
Yeah. So, but I think we fit really nicely in the multidisciplinary space. We do a bit of everything, so we kind of pull from a couple of different healthcare practitioners' tool belts as well, which can be nice because if someone usually sees a chiro and a physio, they usually will just be like, oh yeah, I'll just go in and see an osteo and get a little bit of both.
Yeah.
And then, like I said, we work closely within practice with whoever's in the practice. So just depends on what the clinic's got available.
Yeah, amazing. And look, you said earlier, or when I asked you about like if I was experiencing a condition, I would come see you, like what would the condition be? Do you ever work from the other end of the spectrum of like preventative healthcare? Yeah,
this is a really hot topic at the minute, I think. So, there's been this big discussion about health and wellness, right? So people getting in ice baths, getting in saunas, being on the front foot with a lot of that stuff.
Yeah.
Healthcare is one of those interesting spaces where you don't want to overprescribe or encourage people to come back unnecessarily.
Yeah.
But at the same time, I don't know how to justify unnecessary, because in today's day and age, like I said to you before, I model a lot of the stuff in healthcare or in day-to-day life off like what the pro athletes are getting these days and their care. And, they're getting treated very regularly for different things around the clock. They're being monitored pretty regularly.
And that's all in the name of preventing injuries, right?
Yeah,
because athletes are a valuable asset.
Yeah. So my big thing is, if someone wants to switch to a more preventative model and they're not having any aches and pains, I'm so happy to see them and have them come through my door, and we can work towards doing that. It entails like a little bit of mobility work, some strength training, and then obviously the hands-on in session too. Yeah. But yeah, it almost shifts a little bit from symptom management and trying to find the root cause to then how can we kind of make sure that the risk of further injury or any other injuries is low. Yeah. And that conversation tends to then get led by the patient themselves. So you want to make it something that the patient wants to work towards, or a goal that the patient wants to work towards.
You're not just making them come in.
Yeah, I don't just want them to come back if they don't want to come back.
Yeah.
Like at the end of the day, some people are really happy to just leave it there and call it quits, and if they need me, they know where to find me.
Yeah.
Some people, on the other hand, they might not want to go down that path, and I think in private practice, the hardest part is that a lot of it revolves around a bit of money.
Yes.
So, sometimes people are financially equipped to just come in for, once a month or once every few months. And even if they don't have too much going on, they kind of feel a little bit better for it. I think a lot of that comes down to where you get the patient to, and then what the patient wants to do after that. Yeah.
Yeah. It sounds quite similar to therapy in a way of like, you get so much benefit from going to therapy if there's something wrong in your life, but it's also just as, if not more beneficial, to continue going to therapy so that you have the tools if inevitable shit pops up in the future.
Yeah, agreed. And, you know, a lot of our job is education as well, right? So it's not just about the hands-on stuff, it's about talking through things with patients.
Yeah.
Even having that verbal conversation about things that are going on in their lives and different other health things that they're managing. You know, it's an important part of being able to bounce ideas around with like a, you know, healthcare practitioner.
For sure. And even like, you know, you don't want them to just be treated and then go on their way doing the same old thing that caused the injury in the first place. You want to give them, that, as you said, that education to be able to minimize the risk of injury.
Yeah. So super important to kind of, have that understanding, and for them to have the background as well on a lot of those things.
Yep.
So that then they can make informed decisions moving forward about what they want to do for themselves.
Yeah, cool. And you mentioned before, I guess, the whole preventative care being a bit of a hot topic in the space of osteopathy.
Yeah.
Is there any other like hot trending topics in this space?
I don't know. I think we're going through a really interesting time at the minute. Social media is pumping a lot of stuff up. So there's a lot of what's the word? Clout.
Cloud. I love that word.
There's a lot that's trending in social media at the minute as like a fad, and as like things that people are trying to kind of, I don't know, get on top of early or get the jump start on. You know, things like ice baths and saunas, and we're gonna talk about. So I'm adamant that we're gonna talk about some of this stuff on the podcast because I think it's so good to kind of unpack and understand. Yeah. But yeah, I think I wouldn't say that there's too much else in a sense of other kind of hot topic discussions going on. I mean, I think osteopaths, if anything, the other kind of discussion is that they don't just work in private practice. Like now, osteopaths are starting to branch out into other fields. So you might see them pop up in your office doing like ergonomic assessments, or, you know, you might see them working for a company as a part of the OH&S team, or, you know, there's so many different areas that you'll see like people with osteopathy degrees or physiotherapy degrees or chiropractic degrees or some sort of allied health degree. You'll see them pop up somewhere random.
Yeah.
But yeah, and then that's probably,
about it.
As much as there really is. I mean, I don't think there's too many other big hot topic discussions going on.
Love that.
Apart from just people coming in and getting their healthcare sorted, hey?
Look, I think that's the most important thing, right? That's great. Is there anything else, I suppose, on the topic of osteopathy that myself or the listeners might need to know?
No, I don't think so. I think if you're interested, you just got to get around it and check it out.
Give it a go, honestly.
Give it a crack, pun intended again.
Baracha.
Yeah, but no, seriously, if you're interested in it, and again, like even if it's just to talk with an osteopath or to sit down and find out a little bit more, you know, you can go, Osteopathy Australia is like the governing body for, one of the big governing bodies for the osteo in Australia.
Yep.
So they've got some really cool little information pieces on their website. You can just jump on there and check it out. Yeah, amazing. And look, as someone who had never heard of an osteo prior to meeting Gab and Zeb, I'd give it a go. Like, honestly, you might be for you. I don't think I'll ever go back to another form of different, like physio or whatever. Nothing against them. I just like the approach of a physio, of an osteo rather. Yeah, cool. Well, that's good. I'm glad. Little pep in your step. Amazing. Well, thank you so much. Look, definitely from a personal perspective, it's been cool to hear about like your journey, because we've kind of talked about it, but not in that much depth. Yeah, and I think like you said as well, you know, the last two episodes, like this episode and the one we did before, when we kind of started to unpack a little bit about your space. Yeah. We're just trying to give a bit of an overview, because I think later on down the line we'll probably step into those worlds a little bit more thorough and maybe break some things down that we haven't really discussed about. But yeah, I think just bringing a little bit of attention to them, and as well, you know, like we're gonna get some physios, some chiro being one that's in the works at the minute. Yeah, stay tuned. Just to hear about, you know, their experience in the healthcare industry, because I think one of the biggest things that people don't understand, or one of the biggest things that people are trying to get a handle on, is, you know, what each profession does,
Even
what each
just
allied healthcare practitioner actually does.
Is it informed consent? Is that like it's probably not, but like being informed is always a good thing. Like I was actually having a conversation with an older client last week. She would have been in her late 60s, early 70s, and she's been referred to so many specialists for reasons that she has absolutely no idea for, because her doctor just was like, "Oh, go to these people." Just like, why?
So and a lot of it is just finding out a little bit about an industry so that you can sit there and go, right, I actually think I might benefit from this.
Yeah.
You know? So, the biggest and half the reason that I think these conversations are important is because there is still much. Still much for you to know, Danielson. There's still so much conversation about what is the difference between an osteopath, a chiropractor, and a physiotherapist.
Yep.
It's like a question that goes on for days.
Yeah.
But the fact of the matter is, people don't really understand what each profession does still.
Yeah.
So I think these conversations are really important because they just give people a little bit of insight into that world.
Yep.
And then they can kind of sit there and look at the stats and go, right, this allied health profession is for me. That's where I'm going to start.
Yeah.
And if you don't like it, well, great news. There's like
plenty of others. Yeah. Plenty of other fish in the allied health sea.
Yeah, that's the one. Nice.
Yeah, I love that. Full of the dad jokes today. Oh, well, amazing. I guess for our listeners, although obviously we do run this page and the pod together, where can they find your osteo stuff?
Yeah. So my social media is pretty quiet at the minute, but it's at osteowizeb.
Love that.
Hopefully we'll pick up a bit more once we settle into a bit of rhythm with this.
Yeah.
And then if you're wanting to see me in practice, Sutherland Osteopathy or In Touch Healthcare in Gregory Hills.
Amazing. Alrighty, I reckon we wrap it up there.
Sounds good.
Woo.
Woo. Thanks for listening to this week's podcast.
Be the first to know when the next episode drops by hitting subscribe on wherever you catch your podcasts.
And don't forget to follow us on Instagram at wedon'tknowyet.pod.
See ya.